AIDS is ravaging southern Africa. Vast multitudes of people are sick and dying, many of them through no fault of their own. In Swaziland, a horrifying 30% of children have lost one or both parents to AIDS. Because of this pandemic, only about 1 person in 10 will ever reach the age of 40. Working through Baptist Global Response, a Southern Baptist relief and development organization, believers are making a difference by putting together in-home care kits for families in Africa who are suffering from AIDS. Peter Searson is Minister of Education at Pleasant Heights Baptist Church in Columbia, Tennessee.
What Baptist Global Response does for us is it helps us to do hands-on missions. In our church, people are wanting to do something significant. Baptist Global Response lets us do that.
Pleasant Heights Baptist Church was part of a pilot program to put the kids together. Last summer, they assembled 50.
There's items in there that help them with, it has socks to keep their feet warm because their circulation is bad. It gives them a lip balm to keep their dried out lips moist. It has the mattress protector so their skin's not raw from laying in the bed. It's just basic things to help them to battle these diseases.
Robin Taylor is a missionary who helped get the kids to the families that needed them.
Behind me, you'll see the first shipment of the Baptist Global Response in-home care kits that have arrived here in Pietermaritzburg, South Africa. These kits will be handed out to hundreds of patients in Sweetwaters who are HIV positive and are dying from the AIDS virus. Many times as missionaries, we're often asked, what can I do as an American overseas to help people who have AIDS? And this is a perfect way to be able to assist someone, know that it's going to their home, know that you're meeting very specific needs in a critical time in a person's life. And so this is a very tangible way to be able to get involved and to be able to feel like you are making a difference for those in other parts of the world who really need a difference to be made.
One of the organizations using the kits is Tabitha Ministries. Gail Trollope is the director.
We started first off as a training facility, training HIV and AIDS and home-based care. As a result, we now have an excess of 1,000 patients, where I have 2 sets of home-based carers. The medical home-based carer goes into the houses. They not only assist the family with cooking their food, attending to their wounds, helping to give them medication, washing their clothes, and just seeing generally that everything is under control.
Many of the people helped by the in-home care kits are children like Thibault. Thibault is a little boy living with AIDS. The day after these images were taken, Thibault went to the hospital. The kit materials provided him comfort. This was the first time Thibault ever had his own sheets, toothbrush, and towel. Thankfully, Thibault was able to recover and return to school. In-home care kits are a powerful way of showing people like Thibault that God has not forgotten them and that believers care about their suffering. One member of Pleasant Heights Baptist Church discovered that even the youngest children can help make a difference in Africa's AIDS crisis.
I'm Natalie McGehee, and I have 2 daughters, Lorelei, she's 1, and Mary Madeline, who's 3. The girls want to know, why are we doing this? What's this for? And they can understand to some degree that this is going to another child like them that has a boo-boo, that has an owie, and this has a bandage in it that they can put on there. The 3-year-old is really concerned that there are children out there who don't have these basic necessities that she can go to the grocery store and buy anytime she wants them. But she knows she can pray about it and she can participate in something like this and make an impact.
Not everyone can go overseas, but everyone can say, here's $20 towards a kit. If your church doesn't want to take it on, you take it on. Maybe you can get your class to take it on. Maybe you can say, instead of giving Christmas gifts to one another, let's chip in together as a family and do one bucket. But by doing that, you're saying it's not about me. It's about someone else. And you're doing it in the love and compassion of our Lord Jesus Christ. And that's why we're here.
We encourage you to join with other believers to provide 5,000 kits this year. That's 5,000 families whose lives will be touched by your giving. We also ask you to pray. Pray that suffering will lessen and that a cure will be found.